Welcome everybody to another Thursday Live, number 17. Actually, I'm thinking, Sarah, I should stop saying the number because not only is it dating my show, it's dating me. But this is awesome though. It's 17th edition of our Thursday Live, and we're very excited to have a very special guest. Thank you everyone for joining in today. I think it's going to be a very exciting and certainly timely conversation with respect to disability, case management, and all that stuff that's happening out in your space, Sarah, and certainly in my space as well. I'm Deb Wiegers. I'm the managing principal of the benefits division of Wiegers Financial and Benefits. And we have with us a very special guest that I will be introducing very shortly. What I want to do is talk about a couple housekeeping items before we get rolling. We do want to announce last month's winner of the contest that we ran, and it was for the conference that Bridges had, Breaking Barriers. So it was all about the mental well-being space. So it was very well attended. And I know Bridges were very excited to have such a great attendance. And obviously we know that the topic is top of mind for many, many organizations. So the two winners that we had that were able to join in, complimentary, were Jackie Booth and Jerry Leckman. And I have not yet seen and heard from them, but I do have a certainly call in to find out what their thoughts are and certainly what their takeaways were. I want to introduce Phil. He's kind of over on the side there. Phil is our IT guy. There he is. And he's the one that takes my stress levels down. So a lot of people think it's like Phil. It was like 10 o'clock last night when my computer jammed as I was trying to send you information. And I went, of course, I was thinking it was what I did wrong. But this time it was the computers, right, Phil?
It was, it for sure was.
I was all good. So we are going to have this session taped. It will be on our Facebook and our website. So certainly, if you're not able to stay for the entire session, to take the time to come back and listen to the parts that you weren't able to listen to, and share them. Share them to other business colleagues that you work with and other businesses out there that you feel will certainly benefit from the information that we'll share today. We welcome questions all the time. So at any point in time, we've got a chat line, certainly throw the questions at us. If we're not able to answer, I'm sure Sarah will put my website or my email address on there so people will be able to get back to us and send us those questions. And we will certainly do our best to get back to you ASAP on that. We do have a gift card that we're going to have today. And I'm going to repeat the question twice, but I'm going to get you started because this means that you have to pay attention. So the question that we're going to have today, along with our topic, is: has COVID impacted your disability claims? And if so, what are the solutions that you've implemented or that you plan to implement after today's session in order to manage that? So again, what has COVID, or how has COVID impacted your disability claims? And if they have, what solutions have you implemented or that you plan to implement that will better manage it going forward? Got that written down, everyone? Perfect. So without further ado, I want to introduce our topic today. Our theme of the month is Mind Your Own Health. With that, the conversation today is around disability management. So we really wanted to take a closer look at what is happening in that space of disability management, certainly integrating what's COVID doing to impact that, and how we're going to get through this pandemic marathon and go beyond that, because whatever's happening today is kind of setting the stage for what we're going to see going forward. And you know what, I hate to say it, but COVID has taught us a lot of things. Some things we're not so happy about, but you know what, the positive side, I think we're really paying closer attention to what we can do to be better in this space. And Sarah will be there to help us along with some of those conversations. Sarah Dulong is the manager of the Group Disability Benefits Department with Cooperators Life. She has worked in the financial and insurance industry for 20 plus years, manages a team of disability case managers and rehabilitation case managers at the Cooperators Life Insurance Company. So prior to managing disability claims, Sarah spent 4 years, very good to know, in the mental health claims as mental health claims advisor. So obviously you're very in tune with what's happening today, and certainly you'll have a lot of solutions and conversation to share with us. So that's awesome. Whether you're at work, in your personal life, obviously what you do, this is why you do what you do, because I can tell already, Sarah, from the conversations we have, you're very invested in it. You're very passionate about this space, because it really is all about helping people. And I think in the role that you have, that has to be part of the attribute, because certainly some days I'm sure you find very challenging in your team. And so thank you for being that person that's there to help our clients. So the passion really shines through. You've led initiatives focused on creating future researching best practices for claims, protocol, and seeks opportunities to respond to emerging unmet needs of the members and the clients. And that's that go forward, what we're going to have to, spend more time talking about. Looking for innovative ways, which is kind of what COVID has taught us, to help individuals who suffer to overcome systemic and environmental barriers and live their life to the fullest. Very important. Thank you, Sarah. Thank you for coming on board.
Of course. Thank you for having me.
How is your weather out there?
Well, it's gloomy today and just in time for the May long weekend. So go with the flow.
Yeah.
Yeah.
Don't
exactly.
know where I'm going. So I guess that's a bonus. Although I'm a farmer's daughter and we do need rain and we need a lot of it. So I'm willing to forfeit my long weekend to get a ton of rain so our farmers can be happy as well.
Yes, for sure.
All good. So let's jump right into it. We've got a few questions. We certainly, again, are open to any questions that might come back from the audience. Question number one, we're going to just start kind of like, instead of kind of going back in time, we're really going to just talk about now, here we are today. I mean, the pandemic has been ongoing for many more months than we obviously all anticipated. So here we are, a year plus into the pandemic. Let's just spend some time talking about the impact of COVID that it's had on our clients, both yours and mine, and the members of your business. And what is your role and the cooperator's role been since the pandemic was declared? So give me a couple conversations.
Yeah, for sure. So, I mean, the pandemic has undoubtedly affected everyone in some way, shape, or form. And so we as a business, I guess, biggest thing and biggest change initially was work from home. So many of our clients had a business contingency plan similar to what we did. So we were able to transition quite seamlessly over to work from home. And so that was really helpful that we had a plan in place, because no one could have predicted that this was to come. However, having, a contingency plan in place for whatever disaster we might encounter is so important. So we did recognize the value there. And then for our clients, I mean, we've seen everything from some of our clients being frontline workers, whether that be at a grocery store, whether that be in healthcare. And so there are those clients that are having to go out and live their lives as they did pre-pandemic and be exposed, and the fears and everything around that. So I mean, nothing that not everyone's dealing with, but certainly we've had to learn to adjust with the pandemic.
Yeah, absolutely. And I guess that's kind of the one big thing, because when we're talking about COVID and as it impacts disability, a lot of people are just saying, like, how does that roll into what's my responsibility? How does the benefit program be part of this COVID space? I mean, what would constitute a claim?
That's a good question, and we've received a lot of those questions, Deb. So everyone's dealing with this a little bit differently. There's some level of stress for everyone, I want to say. And so, it's important to remember that disability benefits are intended to help financially support individuals who are unable to work due to their own illness or injury. And so with that in mind, we've been getting claims in for individuals who maybe are off work as a precautionary measure, as recommended by their physician, or they may be at home taking care of a loved one, or children, as we all know, who are off school or have been off school. And so we've had to have some difficult conversations and explain to our clients and educate our clients and come up with fly sheets to explain, what constitutes a claim. And again, it kind of goes back to, it has to be your own illness or injury. So although we respect and appreciate what you're doing to care for your loved one, or, that you want to make the choice to be off work so that you're not exposed, we do have to honor the policy by our clients, and we are able to educate on government, whether that be federal or provincial benefits that may be available in those cases. So it's been a lot of conversation, a lot of new conversation, obviously, but yeah, I think when it comes to what constitutes a claim, it has to be your own illness or injury.
Yeah. And I know that, like everybody, because there's two different mindsets from COVID. So you get it, it lasts a few weeks or a few days and we're back to work and we're all feeling healthy and normal. But that's maybe not necessarily the case. I know, and we were talking the other day about, the new kind of the word, the COVID long haulers. And, it's not that, it's not necessarily that it's COVID that's the illness. It's maybe COVID was part to accelerating an illness. And what are those post conditions that these people are now suffering? And now, the jury's out, right? In terms of just when are you going to be 100%? And I do hear that from some of my, good friends. They said, like I have that cough that still persists. I'm still always tired. So is that going to be something that you guys will see at your end?
Definitely something we've been hearing about for months. The term COVID long haulers. So basically what that is someone who, was diagnosed with and suffered from COVID, even though they're technically recovered and no longer COVID positive, they have residual effects. Now, whether that be lung difficulties, heart difficulties, fatigue, vertigo, there's so many different components to that. And it's so new that there's not a lot of data around it. So certainly we have to keep our finger on the pulse of that. And I know we see different things happening in different countries. So for example, the UK government, they're funding 4 different studies researching causes and potential treatments for long COVID or the COVID long haulers. And other countries have rehab centers that are government funded, set up specifically for long-term effects of coronavirus. So the nice thing with that, with what we're doing at Cooperators, is we have vendors and partnerships where we can leverage that data. So we can compare our claim durations against those countries that have these, supports in place to see, what is the impact they're truly having, and is it something we need to adopt? And so definitely something we're keeping our finger on the pulse of, and something that I'm sure we're going to see more of as things go along. So that's a really good question, and definitely something I'd love to circle back to once there's more data available.
Yeah, absolutely. Because we're seeing it now, right? It's like everything else. Everything's so new. I mean, the vaccinations are new, right? I mean, the challenges we're having right now in the vaccination, because everybody went, you know what, get a poker too, and we're all back to our normal world. That's not even happening, right? So, and I am, and I'm sure many in the audience have been vaccinated, and I'm going, I didn't like the experience post-vaccination. I'm not going to lie. It was not fun, but you know what? I did what I was supposed to be doing. And that's to make sure that I'm healthy so that we continue to keep our whole population healthy. Right. One of the things that we're seeing is obviously, and I'm sure in many countries and provinces, is treatment delays, even just the access to the care that you need when you need it. And I know we see a lot in Saskatchewan, and I mean, our push to get, people healthy so that we're not filling up our beds in our hospitals. So what are you seeing in your side?
Certainly seeing treatment delays, environmental barriers, and it can go back kind of to the long haulers, I want to say. And I don't think we fully recognize the impact that COVID is having on claims that are non-COVID related. So for example, someone who broke their ankle and should be going to physiotherapy, they can't potentially because of a lockdown. And so they're going to be slowed in their recovery. And so what we're having to do to mitigate that is be creative. And so that looks like things like internet cognitive behavioral therapy. Now, luckily that was around for a while. I want to say pre-pandemic, at least we were leveraging it for quite a while before the pandemic. But with that, we were able to evolve quickly and work with our vendor and come out with a COVID program specifically for anxiety around COVID. So that's a way for the mental health piece of it and the COVID piece of it. But again, back to things like a physical injury. So we're looking at things like, I hate to say it, but like a YouTube video on exercises on your ankle recovery. So things like that, or whatever it might be that you're suffering from. So that virtual assessments, we're seeing more and more of those. And we're definitely seeing people buy in more to the virtual piece. Pre-pandemic, people weren't as engaged and weren't as receptive to it. But there's some research to say that people are certainly more receptive and willing to participate in the virtual treatment and assessment options available.
Yeah. And I mean, obviously, and we well know that. And I mean, even just, we need to talk amongst ourselves as, as just a community. And we know the one thing that's really obviously trending high. And it's kind of like staying in that moment. We've already addressed it, in 2 or 3 of the sessions I've had, but it always come back to, our mental well-being and what is it we need to be doing differently to be able to manage that, So I think that's where the insurance companies are really trying to step up and even just for the community, some of the resources. I know that when we had done a session with Penny Murphy and Associates, she's a counselor in Saskatoon, and had a really, really great interview with her. But one of the things that we learned and we implemented was, just the whole idea of having these workshops, because what we want to do is we want to get people in a better position to be more resilient and get those coping skills. But are you seeing on your side, like when it comes to the claims, are you seeing an increase? Or is it staying the same with respect to just those mental health claims? And how does that really impact the drug side of it? Because again, we know that a lot of illness and injuries, alongside come the usage on the drug side. So, and we see the outcome of the numbers, right? So, I mean, it's important for our clients to better understand, like, where is this all going? And am I the same? Am I normal? Am I,
Right.
What do I need to be doing or thinking about differently?
Yeah, that's a two-part question I want to say for me. So when I think about that question, I think about our claims experience, obviously. So we haven't seen an uptick in short-term and long-term disability claim, at least nothing significant. So, that for some might be shocking, but if you look at past pandemics, so I know they haven't been to this, criteria or level, but something like SARS, research has shown that the uptick of mental health claims came after the pandemic. And so some of the reasons behind that is because during a pandemic, there's things like job loss, job stability. People are worried about that. They have no sense of normal, right? We're all stuck at home. And so sometimes work is someone's level of normal, and they maybe are working when they shouldn't be. So things like presenteeism come into play. They're there, but they're just plugging away. They're not being productive. And so it'll come a point when things kind of start getting back to normal that we'll see the burnout and we'll see the disability claims influx. So I think it's too soon to say, how the pandemic has truly impacted claims experience. That said, with the drug side of things, we have seen an uptick in mental health claims for drugs. So it varies by province, and it's anywhere from 10 to 30% that it's gone up. So that could be a precursor of claims to come as well. So again, it's kind of, too soon to say, but if we look at past research, I would say that we're still not at the point where we're going to see that uptick, but that it's coming.
Yeah. And because it's kind of like, it's because of the COVID, we all want to think about this. When it all started, we had 6 weeks, we'll all be back to work and life will be normal. Okay, I'll give it 2 months. Or what do you mean it's 6 months? Well, now it's a year. Now it's a year and a half. Like really, even this year, there's still so much up in the air. And the vaccination is adding to that because there's all these other things and conversations that are coming out of it. And I do agree, Sarah, because we some of us are taught to have resilience. Most of us are taught to have resilience. But the question is, where's the breaking point? Where's the breaking point where we say, like, you know what, I kind of had enough. I don't think I can do this anymore. And sadly, what it's doing is it's creating people to, maybe kind of bust out and not follow rules because they're going, I'm like so done with this. And I'm going to go see my family member and I don't care what anybody else thinks. And I understand that. But unfortunately, we also know now how that can come and like hugely kick us in the butt, put us right back into the COVID, like at large. And we're basically starting all over again, trying to clean things up, right? With these new strains that are out there. And that's where I go for you folks. I mean, I don't think it's going to be done for quite some time because I think as these new strains and variants come out, and what's the long-term repercussions of this mentally and physically. I'm sure there's lots of interesting conversations at your board tables going, if we could predict what's it going to look like in 6 months and 12 months, it'd be interesting to put all that down into writing and then actually compare notes come the 6-month mark and the 12-month mark. I'm thinking that's what you guys are going. Like, I think we know what's going on, but do we know what's going on? I don't know. What do you think?
Right. Yeah, you're right. And it is something that you can't really prepare for. And luckily, we have a really good corporate strategy, and our leaders, our executives did, a leadership conference for all of the leaders across the country where they talked about the strategy. And I think the important thing, and one takeaway that I had, was to remember how you contribute to it, to the strategy, and what your day-to-day looks like in regards to getting to where we need to be. And of course, we have to think of the pandemic and how that impacts, but bigger than that, we have to think of our people. And so when we're talking from a claims, and a support perspective, it's about our people and making sure our people are supported, because how are we supposed to support our clients if our people are struggling? And so it's kind of taking a step back and realizing, sometimes you look at my team even, and clients may look at the team as these are disability case managers, and they don't think of them as real people who are going through many of the same things. And so it's really just taking a step back and being holistic and putting our people first. I like to use the analogy, don your own mask like you do on a plane before you help others. And so, with that, we've done different things for our staff to make sure that they feel supported and that they have resources available for them.
Yeah, absolutely. Well, to your point, we were talking yesterday, and Sarah's got a young daughter at home, and here she is at work at home with a sick daughter and trying to be out there caring for people, right? So quite the challenge. And I mean, your level of ability to cope, it gets challenged, right? So
Sure.
and we do have to remember that. And I see, again, I think I go back to that, be kind. And I always think about what's happening on the other side of that, because if you're having a bad day, maybe they're having a bad day too. Maybe we need to talk about that bad day or work better together, because being controversial, being demanding is not going to solve anything, and no one wins out of that, right? So it really goes back to, and we'll maybe talk a little bit about the tools, like those tools and resources. And we touched really lightly on it, because no different than you're going to share that with what, your members, the policyholders need to be thinking about, but you're going to be utilizing them as well, right? Mm-hmm. So one of the things that, you'd mentioned was the cognitive behavior therapy. So the ability to virtually go online and be able to talk it through with somebody. And, a lot of people were very intimidated by that whole process, because the thoughts were like, if I can't see that person, in person, how really are they going to help? No different than the doctor. But let's just talk about the cognitive behavior therapy. Like, are you seeing an increase or an influx with that resource being available to the policyholders?
Yeah, so with that ICBT, so again, it's been around for a while, and research has shown, like, it's been used in Australia and the UK for 10, 15 years. And so research has shown that it is as effective as face-to-face therapy, which is amazing. But the benefit of this is it's also available to people in rural areas. So, a lot of times there are farmers who are struggling. Again, like you said, this time of year, no rain, we don't know what everyone's dealing with. And so accessible care is so important. And being able to, grab your phone, grab your iPad, get on your computer and go through these courses is so valuable. There's some statistics, and I don't want to talk numbers all day, but like 60% of individuals who suffer won't seek help for fear of being labeled. So that's stigma. Even though we're having the open conversation, it's there. And I don't know how long or if it'll ever go anywhere. But, all we can do is try to mitigate that. And so by having these virtual options available, someone can do it in the privacy of their home. And as much as we encourage them to talk about it, that's their personal choice. So, we're making sure that these treatment options are available, and valuable treatment options. So again, it's as effective as in-person therapy. And so, with the ICBT, we have found that 80% of individuals who have gone through the program have taken away something and have been able to leverage that and use it in their day-to-day. So that's really great. That's just one of the many tools that we have available as staff of the cooperators, but that we also make available to our clients. So,
well, virtual care. Let's just talk about virtual care, because when you talk about virtual care, like it speaks to a lot, right? And again, no different than we didn't think online therapy would be effective. Everybody, when COVID first hit and all the shops were shut down, it was like, all right, so how do I go about getting my physio treatments? Because if I don't continue my physio treatments, and I've seen that, because for fear, and maybe the practitioner that they were working with wasn't there and wasn't ready in that space, because that was probably the biggest of the challenges when this started. Is like, sure, we can say, hey, everybody gets virtual care, but who as the providers were actually doing it? And so that created a problem, because now the people that were in, their process of getting well, and they needed this treatment regime, all of a sudden everything stopped. Right.
Mm-hmm.
So now I know, and I see, and I think the one that kind of always think that'd be toughest to do is, how do you virtual care physio? How do you virtual care massage? How do you virtual care a lot of your paramedicals? But here's what's happening. It's happening.
Mm-hmm.
And so, you know what, it may not be and look the same as what you would do when you go down to a business, but you know what, perhaps maybe it's even more effective than going down to the practitioner. And so again, the practitioner is still there to provide a level of service, because that's what they do, but the employee or the patient is able to still to continue in a regime. So for you folks, like at the cooperator side, like, do you, like when this first started, you probably were asking them maybe that, like, who out there does virtual care? So when you're talking about, getting a person back to work physically or mentally, where are the resources for you? So from the start of this to where you're at now, how have you seen that grow and expand out there so it makes your jobs much easier?
I want to talk about mental health, obviously, because that was what I did for 4 years prior to this role. And so one thing that we have recognized, and we did a research pilot on, was the mental health second opinion consult. So I want to give a bit of background on that. So in Saskatchewan, we have 77 psychiatrists. So the wait time to get in to see a psychiatrist, let me back up a bit, actually. So when you go to your family doctor and you talk to your doctor about, whatever your struggles might be, oftentimes you'll get prescribed an antidepressant, potentially said, hey, take some time off work, whatever that be. You go home, you're not feeling better. And so you get referred to a psychiatrist. There's a wait time of 6 to 12, sometimes longer months to get seen by a psychiatrist. And so GPs maybe are educated on, GPs being general practitioners or family physicians, are educated on a couple psychiatric meds, whereas, psychiatrists know hundreds of them. And so there's a real value in being able to be seen by a psychiatrist. And so again, when there's only 77 available in this whole province, and that actually is larger than in some other provinces, it really puts a barrier in the length of time you wait. So if you're waiting that 6-12 months and just spinning, you're obviously going to probably regress. So what we have been able to leverage is the mental health second opinion. So that is in a partnership with World Care. And so World Care gives us access to the World Care Consortium. So they're out of Boston, the Mass General Hospital. And it gives us access to over 600 Harvard-educated psychiatrists and psychologists of all subspecialties. So you can, take your family doctor's recommendation for medication, and you can give them a call and say, hey, like, I'm just not getting better. And they'll collect that medical information. They'll look at the report, the medications, and they'll give you a holistic plan of, here's what you can do. Here's the medication you should try. Here's some therapy you should try. And they'll share that report with the doctor, the family doctor, who's waiting for that psychiatrist referral, and the claimant. And so, that's been a very good resource, and we've seen really good recommendations come out of that. And so I believe 70% of the individuals who had that done got a new diagnosis. So how do you treat someone if you don't know the diagnosis appropriately? And so 70% got a new diagnosis, 90% got new treatment options, and 60% were able to return to work. So, I mean, that's pretty astronomical. And again, it's just something that we've had to get creative with and leverage that. Trying to think what else. Addictions is obviously a big component right now. A lot of people are self-medicating with alcohol or other substances. And so we are seeing claims come in for substance use disorder. And obviously a lot of inpatient facilities are closed or full. And these individuals are stuck at home, and it's very difficult for them to abstain. So we've had to work with vendors and find creative ways to, make sure that they get the support they need, but also monitor compliance. So we've seen some unique things like breathalyzers being couriered to individuals' homes, to make sure that they're being compliant and they're abstaining, and they'll be sent kind of just out of the blue, so they can't really prepare and not drink. And when they blow into the breathalyzer, it actually even takes a live photo of them so that they can't have, a spouse or family member blow into it for them. So there's really creative ways that we're trying to support people, and that we have reached out to vendors to learn how, what they can offer. So again, it's just being creative, and I'm sure there's more to come, but I guess those are just a couple things.
And you mentioned too, and the one thing, the second opinion, like World Care is the source for you folks, but I mean, second opinion is very common in most group plans. But that said, most people don't even know A exists, B don't even know what to do with it. So to your point, now in today's space, there's much more need to maybe reach out, and exactly that. What we find often, and it will continue to grow, is you can't pay a claim if you don't have a diagnosis.
Mm-hmm.
And so they get stuck in limbo, right? And I feel bad for the patients because they want answers, but they don't know where to go to get those answers. So I think that'll be a really, I guess, important part when you talk about kind of those other resources that you can go to. The one thing too that you had mentioned when we were chatting, you talked about your mental health bundle, and that kind of add on to your health benefit, and really taking and ramping up the services to that next level. So when my clients are reaching out to their employees, there's that next level of care that they can have. So maybe just share a little bit how that works, because I found that quite interesting.
Yeah, so we did enhance a mental health bundle, and this is available to our clients with over 100 lives. And again, we're looking for opportunity to even offer it to smaller groups, but we have it as staff at cooperators. And what it allows is $5,000 per year in paramedical coverage. And so that's separate from a personal spending account or anything like that. So this paramedical coverage does give the opportunity for someone like myself to go out and see a psychologist. And I don't know if you know this or not, Deb, but a psychologist runs about $180 to $220 an hour. Most benefit plans have a $500 coverage. So, you're seeing the psychologist twice, maybe 3 times, potentially, with a little bit out of your own pocket. And for most mental health conditions, you're expecting weekly sessions of about 8 to 12 sessions to really get, your bang for your buck, or to see an improvement. And so, only being funded for 2 or 3 of those is a challenge, and a lot of people can't afford that outside their pocket. And so being able to offer our clients $5,000 coverage, I believe it's also available in $2,500, $2,500 denomination, is really, it's amazing. I don't know if I've seen a plan that's better than that, but I know that it's there.
But that's a good thing. And what's nice is that you're a local based company, which is even more awesome. So what that does is it speaks to the world, the space you're in, that there's work to do, there's opportunities. And you know how that goes when someone comes up with a great idea. Most everybody kind of goes, that's a great idea. Let's do what we need to do to follow. And we need that, because obviously many insurance companies out there. So, there's lots of love to share. So the more that our suppliers can get on board with these types of programs, it certainly makes our worlds easier. Like the one thing that we do in our space as a benefit advisor, we talk about, obviously, the things that come quite simplistic, easy to administrate. And unfortunately, but this is the deal, it's got to be cost effective too, right? And ability to budget. So one of the things that we talk about, add the employee assistance program. That's like key, because hopefully what we can do is solve some of those things before we get to the bigger problems. Another thing that we're seeing now is a lot of common or interest in expanding the paramedical benefit. So I know I had a client, and it usually takes an experience to kind of move a decision or move into a new space. And in this situation, it was a business owner that really suffered mentally. And so he gets it, totally gets it. And so it was important for him that they went and took their psychologist and social worker. And even some of the insurance companies are expanding in terms of the experts that they can utilize, because we need more out there. Anything's better than nothing. But he expanded his paramedical benefit for psychologist and social worker to $1,000. And he understands that those claims will potentially come in, but he also understands if he doesn't do that, the impact it will have on that employee and their family, because he experienced it. So it became incredibly important to him. So those are the kind of conversations now we're starting to see out there, is that, you know what, when it comes from the top down, we need it to be at this level. We need people to understand that I get it, because I was there. I was in that space. Because to your point, as an insurance company and your department on the disability side, it's you're in the same space as everybody else. So we need to get the tools to ramp up. If I need the help, then my employees need the help, because if I'm not there functioning, my employees don't have a business to go to either. So we have to work together on this. It has to be very, very collaborative, right?
Absolutely. And lead by example, right? That's exactly what it is.
Yeah, exactly. So we talked about a little bit, we'll talk about early intervention, and then I got another question. So early intervention, really now trying to take this and get more, like, talk about it before it gets into a claim. How are you folks doing that? Like, because we don't want to wait for it to hit the paperwork, because we also know that it's been going on for a while, whether it's mentally or physically. So where are you guys in the space when it comes to early intervention?
That's a good question. And I think it's important, first and foremost, to know your staff. So as a leader, understand when your staff and when they're struggling, and just get to know them on a personal level, so that when you do see something off, you can start that conversation, and then from there leverage things like early intervention services. So what that is basically, if I had a staff member that was suffering and I could tell that something wasn't right, and I wanted to offer some support, I could refer the file to what's called early intervention services. So we would still continue to pay that employee's salary, but what they would do is reach out to see where there might be opportunity for them to make some treatment recommendations, or to liaise with their doctor to say, hey, they're having these symptoms, what are we going to do, kind of thing. So this is a service that would be available before it would come to a long-term disability claim. And so a lot of employers are using services like that as a proactive measure, to kind of be able to offer that extra support to their staff.
Yeah, good to know. Good to know. So let's share, because I know we talked about, what are those things, like, they just don't have to be related to, the service in particular, that what you do, but it's kind of, what are those things that we're trying to do in our spaces? So you share, and then I'll share a little bit what we're doing at the Wiegers and that you're using to implement and bring the team together to provide a level of care and camaraderie, and that you guys can really share in this journey together, call it that. So give me some examples of what you're doing on the cooperator side.
Oh, that's a fun question. I think there's so much research around what to do, what not to do. Should you do Zoom video meetings? Should you not? People are having Zoom fatigue. But I think there's a lot to be said in having these conversations and seeing someone's face and reading nonverbal body cues. So for us, I know my leadership is very focused on having these live videos. And so as leaders, we're kind of given the autonomy to decide what that looks like. And so for me, I do monthly meetings with my team, whether that be a coffee date, whether it be a game show we play, whatever it is. So we try to do that and to keep things as normal as we can. We try not to talk work during those times. I think that's important too, kind of what you do on a lunch break in the cafeteria or walking through the park. So that's something we do. Our company actually came up with what's called Co-op Connect. And so what that is basically a platform to share different things like lift sessions. So that can be yoga. There's different weekly things that you have on your computer, wellness breaks, things like that. So again, it's about those conversations. It's about those touch bases. It's about just staying connected and supporting each other, at work and outside of work, and really just listening sometimes. And the simple things are what's really making an impact right now.
Well, and particularly for people that are truly in isolation. I'm very, very fortunate that we've got a large enough office that we can rotate and we can get people back to work. And I think, to be honest, I think 98% of the team is like all over it. They just because there's a point in time, and I think about my daughter who, getting out of bed and going to university is like, oh, this is awesome. I could sleep in, I could get up, I could be online. I could be in my pajamas. And that soon went away. It was like, oh my God, I want to get to school. I want to socialize. I want to be with my friends. And so this personal connection, I think, is the biggest thing that we find that people are struggling with. For the introverts, maybe not so much, but certainly for the extroverts. And in our business, we're a lot of people that are extroverts by virtue of what we do. Right. And so I know on the Wiegers side, we worked swiftly and very much thanks to Phil over here, because Phil was probably the guy that probably got worked the hardest over the week of, right? Phil, it was like a 24/7, get everybody online and get this thing rolling. But one of the things, that I found that has been hugely effective, to your point on some of the connections, we went into what's called Workplace. It was a platform, and we started to create, kind of the means in which we can, reach out to our employees. So we did a wellness page, right? So anything motivational, breathing, you talk about yoga. We've got, Lisa in our office, and she's very, very vested in yoga. So she was sharing with us some of the things that we need to be mindful of. There's another page called Local Love. I love this one, Local Love. So it's all about community. Because community, what we do and we share and we give back to the community is part of what makes us feel good, right? So when we talk about, disability management and all those things, there's beyond those things that still become very, very important. So right now, I know my son Colton is very invested with the Big Brothers, Big Sisters, and we're rolling it into the ability for us to not just say mentally stay healthy, but physically stay healthy. So now it's all tracked, pedometer tracking. So nice. I think I'm going to win this one. I got a lot of kilometers at track in a week. So now we're doing a great thing, but we're getting healthy all at the same time. And this did not cost a lot of money. It takes a few people to cheerlead it, right? To keep pushing the message. And even just what we do, and we call it with the social committee, but we've got another one called All Things Awesome. All things awesome. Let's celebrate, because when you're not in the workplace, you don't get to celebrate your birthdays and anniversaries. I passed an exam. I'm getting married. I'm having a baby. So it's really cool how this tool, simplistic as it is, became so huge to our organization to keep us, connected. Because I think that's really the one thing that, because of the many months we've been into this, that's the one big thing that people are really struggling with. And we're not even in the places that the big centers, the East and the West are, right? So right. We're very fortunate. And we do a Monday, Wednesday, Friday check-in. So we get a motivational, get your day started. We got a Wednesday check-in, and we got a Friday, have a little fun with it. And have a great weekend. Don't talk about work. So, we always say to my clients, I said, it doesn't have to be rocket science. It doesn't have to cost a lot of money. It doesn't have to take a lot of time. There really is a lot of those. And if we can do those things, hopefully we're going to see us managing what's happening with the activity of our health, so that you folks, you'll always be busy. So it's never that you'll be out of work, but you won't be so busy that you're now feeling that, the stressors of trying to stay on top of that. So I share that with the audience, because a lot of people say, what do we do? And you know what, I've got an exceptional team that they're always thinking about those things that we could be doing differently. When the Easter Bunny comes drops gift baskets off at the doorsteps, like, you can't imagine how that makes people feel. Like, it's the coolest thing. Like, it's the coolest.
Nostalgic. Yeah. That's nice.
It is. So I'm going to wrap it up with a question. We've got about 7 or 8 minutes here. Life. What's life going to look like today and beyond? What do we need to know about what we're going to do going forward? What did we learn from the past pandemics? And how are we going to apply those next steps? Thoughts?
I guess my thoughts kind of circle back to taking care of ourselves and taking care of each other, not losing sight, once everyone's vaccinated and things start to open up, that there's going to be continued struggles, to leverage the data around that, to see where we can be proactive in supporting, each other, our clients. So, I think I've learned that we are resilient, and it's nice to see that people have embraced virtual care. I love seeing the creativity that's come out of this, so there are some positives that have come out of this, and that, I think we can take away lifelong and continue to innovate, and I guess, just support each other.
Yeah. And I find that, because this is always a challenge, like as a business owner myself, and working with many business owners, is, obviously, first and foremost, the business has to come first, because that's kind of why they're in business. But if we don't take care of our most important asset, being our people, we'll fail. We'll fail. So I think I'm seeing from an employer's perspective is they're really nice to try and help be taught what is it they need to be doing maybe a little bit differently. Some do it exceptionally well. Some, it's just kind of matter of fact, you come to work, you go to the field, you do your thing, you go home, and the day starts all over the next day, and not really thinking about these little pieces that have to float in between that are kind of the glue that keeps the organization together. So I know that it's difficult, and depending on the industry that you're in, if I've got clients in the trucking industry, their space, how they would apply these things that we've talked about are very different. Does that mean it's impossible? Probably not, right? It just means I think that the desire and the want to do it has to be there. And so I can't, impress enough that, as employers, and, it's a new space that we have to kind of roll into, but it's the space we're in today, and it's not going away anytime soon. So, to create, a way and a means to have, a safe haven for our employees.
A safe space to share. Exactly. You hit the nail on the head. Like you need to, as an organization and leaders, create that safe space for conversation, safe to fail. Sometimes you're going to mess up, different things like that. Right. So for sure, that's a takeaway.
And we're not exactly that. We're never going to get it right the first time around in business, in any level, in life, in any level. We're never going to get it right the first time every time. But it's what we learned, right? As Cliff would always say, problem solution. You know what? We got a problem here, so let's talk about solutions, right? And if the solutions don't work, then let's work on what the next option might look like. And I think it's kind of like that work in progress that we always have to be mindful of. And I know for some of my mid to small clients, I think part of the struggle, Sarah, is they don't have the infrastructure probably in place to be able to, put the time into some of these areas. And so how can we better as a community provide, those tools and resources that make it a little bit easier for them? So on the benefit side, again, we talk about, some of the things that we can bring to the table. As we start getting into a workplace, are you at work? Are you at home? I know in a session that I was watching a couple of days ago, they talked about, the new way of it is going to be hybrid, right? Sometime at home, sometime at work. And the challenge is how are we going to be able to accommodate that and work with that, because it's new to us. So I know one thing that you and I talked a little bit about, and I think this would be really cool to circle back and have this conversation about how is it looking? What have we been working on? What do we need to change? But how can we be better at helping our HR departments, right? Because these are the people that are there to kind of, they're in the middle of this, right? The employer on one side, the employee on one side, and their objective is to make people well, keep people well, keep them at work, keep them present at work, right? I mean, we talk a lot about absenteeism and presenteeism, and I mean, it's off the charts now, presenteeism, and how you can't put your finger on that. You can't, and so
especially when we're working virtually, right? So it's
absolutely
more difficult. Yeah.
Absolutely. And I know that, for us, we've had to pivot a bit in terms of just what are the tools we're doing as an organization? What are the things we're doing to help our salespeople, for example, because now they're working remote, either 100%, 50%. So how does that work? Right. And because, I mean, obviously part of what makes them feel good when they get out of bed is they're successful. But if they're working from home and they're working from a kitchen table, that makes it difficult. And sadly too, and this goes back to you as a quick question on a wrap up, because that's where we're going to see the work from home space is great. The hybrid conversation is great, but now it introduces a whole new conversation about the workplace that you're in, because that now spills over to potential for, yes, the mental space and the physical space. Right?
Absolutely.
Because I mean, how many people actually have a good workplace at home that if they need to be working on staying physically healthy and they're working in a space that's not working for them, where does that conversation go? So employers obviously are going to be part of that, whether they like it or not. It's going to be good, bad, or indifferent conversation, right?
Absolutely. Sitting in the chairs that's probably not ergonomically correct, or, sit stand stations, exercise equipment. I've seen bikes under desks. I've seen so many different things that, we're going to have to explore. And I think you're right. Like maybe this is something we circle back to on the future of work with HR and see, you know, what are they seeing? What are they doing to mitigate those things, especially with the hybrid model that's going to be, you know, implemented in so many workplaces. So super interesting stuff and potentially a lot of impact, especially from a claims atmosphere. So
Yeah.
we'll have to
And
keep
it rolls
our eye
out
on that.
maybe another great conversation is, you know, how the impact of that's going to be on the occupational health and safety side, right?
Yes.
I think we
Yes.
talked a little bit about that, where you talked about, you know, having someone come in and assess their workspace, because for you, when you're rehabilitating people, that becomes part of the conversation, correct?
Well, pre-COVID, I always worked from home. So, you know, part of that was having a leader checklist, and my leader came and walked through my office space and my home to make sure it met all the criteria, including having a fire extinguisher. Obviously, with a pandemic, so many people, our whole company got pushed to work from home. And given it's a pandemic, leaders can't come into your home, right? Like we're not allowed to go into other people's homes to check these things. So it's been a year plus with people working in conditions that weren't necessarily acceptable pre-COVID. But again, we have to evolve, we have to be creative. And so, yeah, what does that look like long-term and what kind of plans are going to be put in place to make sure that, you know, our staff are being supported? So.
Yeah, exactly. It's new. It's been there. It's new, but we're needing to make more efforts to improve.
Absolutely. With everything. Yeah.
Absolutely. So no, this has been very, very, very interesting. You know what? A lot of takeaways. I know that there's lots more we can be doing. The good news is that you know, there's a lot of people that are really putting in a lot of emphasis in terms of just making things better along the way. I think that for us, you know, the big one is encouraging a healthy workplace. Right. And like you, like us, I mean, we really believe in a holistic approach to a healthier bottom line. So that becomes incredibly important. And what does that mean? Well, that spreads out into 2 or 3 or 4 different areas. And I think the key is to make sure that we don't treat these things in silos, because they really all come together. I mean, and that's probably what you're learning at your end on the disability management side, is that you can't just treat this if we don't understand what's happening in these other spaces. And so how can you flow that, you know, that level of learning and teaching over to the employees and the patients and to get that level of care that they need to help the employer and to help the community, right?
Exactly.
So this has been awesome, Sarah. You know what? Lots of great conversation. I think that we will circle back. We will have that conversation and coordinate to the HR side. I think that will be quite interesting. We do have one question before we go. So what are employers' rights when they feel an employee is faking or feeling the claim is dishonest, especially when the employee isn't properly communicating with the employer?
What are the employer's rights? Is that what?
Yeah. When they feel an employee is faking or feeling the claim is dishonest.
I mean,
illegal, but do you have a comment on that?
It's a bit of a legal question, but I can give a shot at it from a claims perspective. So, I mean, what you have, I would say as an employer, like, to submit the claim and let the professionals, so let your case management team decide, you know, if the medical supports it. And I know as an organization, we have, you know, tools in place to make sure that if a claim comes in, we're exploring, you know, all of the factors. So an individual's global functioning, they can't work, but they're able to go to get groceries every day. They come to their appointments and they're well kept, and all these different things. There's so many different things that we look at. There's criteria that you need to meet to be clinically depressed. I'm assuming this is potentially a psych claim or a psychiatric claim that you're referencing, and I forgive me if I'm off base there, but that would be my suggestion, is to just submit it and let the professionals decide, and make sure to share what you're seeing and observing with the case manager, so that, you know, the more information that we have from a claims perspective, the better. And so, you know, we're always open to listening and hearing, you know, your observations.
And that's a great point, because I think a lot of times we get that conversation, particularly when it comes to the mental well-being space, because everybody gets, you know, a little bit discouraged, I guess, because they feel that, you know, at the doctor's visit, it's a 30-day script, take 30 days off and, you know, see how you feel later. But it's not that. And I really have to remind my clients all the time. He says that you have to understand that there is a team of experts, and they will be looking at the information that's provided on a medical level. And the other part that becomes really, really important is there's got to be an effort. So if the claim is submitted and you're seeing, the information you're in, and you create the diagnosis and the treatment plan to get better, the employee has to embrace that. The employee has to stay involved and wanted to be doing those things that make them better. If they don't, that claim will get refused. So it's interesting because, of course, sometimes you don't understand what's going on in the guts of this stuff. We just see face value, and we really have to, kind of educate our policyholders that you can't just assume just because they're submitting the paperwork, it's going to go through. If it's there and it's needed, absolutely, that you're there to provide the resources to get that person healthy and back to work. But there is an onus on the employee to want to make that difference too, on every level, whether it's mental health, whether it's a physical claim. It really becomes a three-way process, right?
Yes, for sure.
So perfect. Right. Okay. Well, you know what? I want to say thank you much. We're just going to couple closing housekeeping items. I do want to remind people of the question that we had, and I'm going to just reread it again. Or do you want to put it on the screen? I don't know, Phil. What are the things? Oh, where are we here? Oh, it's over there. How has COVID impacted your disability claims experience? And what solutions are you implementing or planning to implement as you go forward? So that's the question. Submitted. $25 gift certificate for the Cavalier to use at either or any of the sessions. We are encouraged by any questions that you might have following this. Do send us an email. Next month, we've got Jason Abig. And Jason Abig, CEO of the Greater Saskatoon Chamber of Commerce, is going to be our guest. And we're going to have a little bit of a different approach. Looking forward to it because we're going to maybe do a little bit of maybe a panel discussion and talk about what makes great businesses greater. And what are those things that business, COVID or not, what are the things that we need to be as businesses to be doing great or greater? So I'm really excited to have Jason on board, and we potentially might have one extra special guest as well. Sarah, thank you so much for being part of our session today. Lots of great information. I certainly had some takeaways, and I'm encouraged by anybody that might want to speak more to us about some of the work that you do at Cooperators. Thank you for being there, Cooperators, and being such a community-minded company. We're always grateful for companies like yourself that you really are working out in the community to make things better. So thank you again. Thank you to the audience for joining in and taking time out of your busy day. I want you to have a wonderful rest of the day and absolutely enjoy this long weekend, snow, rain, or not. Get into those jammies, get on the couch and don't just watch one movie, maybe watch 3. That's what you deserve if you really need to. So thank you again. Have an awesome day. Take care, everyone. Stay healthy.
Thanks, Deb.